the patella fracture. Okay. Before going to patella fracture, there is one term you should know. They might ask you, this is called as OFAS fracture. What is called as OFAS fracture? This is coronal split fractures of distal femoral condyle. Distal femoral condyle. So distal femoral fractures, OFAS fractures you should know. They are coronal split fractures of distal femoral condyle. It's called as an OFAS fracture. It's called as an OFAS fracture. So if you see the distal femur, so I am drawing the lateral view of distal femur. So distal femur is like this, and the tibia is here, and this is the knee joint. If a fracture occurs like this fracture is called as an OFAS fracture. This is a coronal split fracture of distal femoral condyle. That's called as an OFAS fracture. 100% requires surgery. 100% requires surgery. Okay, it requires absolute fixation. Very, very important. Okay, so this is about OFAS fracture. Now coming to the next topic of lower limb fractures, that is patella fracture. See, patella fracture are one of the fractures which you commonly see in day-to-day practice, and we'll just see about the patella fracture. Before that, the small anatomy about that. We'll keep this diagram itself, and there is a bone here called as patella. Now, patella has got two attachments. One, proximally, it gives attachment for a muscle called as quadriceps femoris muscle. Quadriceps femoris muscle has got 4 parts in it: rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius. So quadriceps femoris gets attached here, and there is a ligament which runs from the inferior pole of patella to the tibial tubercle or tibial tuberosity. This is called as ligamentum patellae. This is called as ligamentum patellae. This is called as ligamentum patellae. Now just imagine if a fracture occurs here. If a fracture occurs here, okay, there are two forces which are pulling the patella from the opposite side. So the fracture can easily displace. Okay, so the fracture can easily displace. Can you able to see here? The patella fracture, this is the fracture line. So one force is acting here and another force is here. So the fracture patella can easily displace. So patella fracture usually requires fixation. The fixation which is routinely used is called as tension band wiring. It's called as tension band wiring. Tension band wiring. In tension band wiring, this method converts the surgery method, this tension band wiring method converts tensile forces into compressive forces. Tensile forces into compressive forces, so that the fracture gets compressed and heals nicely. So in tension band wiring, the tensile forces are converted into compressive forces, thereby the fracture heals nicely. How they do tension band wiring? So in this picture you can see the tension band wiring being done. They have put 2 K wires, and around the K wire there is an SS wire which is tied in the form of figure of 8 pattern. So this surgery is called as tension band wiring surgery. Okay, this surgery is called as tension band wiring surgery. Now you can see the fracture being reduced nicely. So whenever this principle is used, this principle converts a tensile force into compressive force. So for patella, the most common surgery which we do is tension band wiring. Tension band wiring in the form of figure of 8. Sometimes if it is more comminuted, if the fracture is more comminuted, then we use cerclage wires as treatment. Cerclage wires as treatment. Cerclage wires as treatment. Just you tie the patella with a circle of wire as a treatment method. So that is the way to treat patella fractures. Okay. So next, after patella, you have got the proximal tibial fractures. Okay. See, one view I forgot to tell you is this view. Just to tell what view it is, I put this picture. No fracture in this. Patella is usually well seen in this view, and this view is called as skyline view. Skyline view. If you see a patella, an X-ray like this, and if they ask you what is this view, then you call it as an Skyline view. Skyline view. Repeatedly asked picture-based question. It is skyline view. Okay. So next we will see about tibia fractures. Tibia fractures, nothing much to discuss in it. Tibia fractures are, it can fracture proximally. So proximal tibial fractures can happen. Proximal tibial fractures. It is classified by a person called a Schatzker. So it is called a Schatzker's classification. So Schatzker's classification is used for proximal tibial fractures. Usually proximal tibial fractures are intra-articular fractures. Usually they are intra-articular fractures. So most of the time they held in surgical fixation. So they require surgical fixation. So proximal tibial fractures are usually intra-articular fractures. So they require surgical fixation. Proximal tibial fractures are classified by a classification system called a Schatzker's classification system. Okay, and next is tibial shaft fractures. The most dreaded complication in tibial shaft fracture is one is compartment syndrome. Compartment syndromes. Okay, because in the thigh, if you see the cross section of the, sorry, in the leg, if you see the cross section of the leg, you can see two bones in the leg. One is called as tibia, another one is called as fibula. These two are connected by a membrane called as interosseous membrane. And there is a fascia which is surrounding the leg, which is called as the D fascia. From the D fascia, you have got various septas running here. So you got various compartments in the leg region, anterior compartment, lateral compartment, and posterior compartment is here. It is further divided into deep and superficial part. So there are a lot of compartments in the leg. Whenever there are a lot of compartments, compartment syndrome can also in there. Okay, in the morning I told you 5 things to remember about compartment syndrome: pain on passive stretch, pallor, pulselessness, paresthesia, and paralysis. So these are the letters you should remember when you have compartment syndrome. Are you clear in this? So in a tibial shaft fracture, compartment syndrome is more chance. There are more chances for compartment syndrome. Now, how you treat a tibial shaft fracture? If it is an undisplaced fracture, you can treat it by POP. If it is a displaced fracture, in children's, you can treat it with tense nailing, whereas in an adults, you can treat it with intramedullary nailing. You can treat it with intramedullary interlocking nailing. Interlocking nailing. Okay, clear? So it is a displaced fracture in children's, you treat it with tense nailing. If it is an adult, you treat it with intramedullary interlocking nailing. Okay, so this is about the tibial shaft fractures. Now coming to the ankle fractures. So before going to the ankle fractures, a small tip about anatomy. I didn't talk much about the anatomy of knee joint specifically because when it comes to sports injury, most of the injuries occurs around the knee. So at the time I will tell you the anatomy of knee joint. So now we'll see about the anatomy of ankle joint. So in the ankle joint, you have 3 bones which is participating. So the lateral side you have the lateral malleolus. The medial side you have the distal tibia and the medial malleolus. And wedged in them is the talar bone. This is the talus bone. This is the ankle joint. So there is a ligament which runs from the medial malleolus to the talus and to the calcaneum. So that ligament is called as a deltoid ligament. So this ligament is called as a deltoid ligament. And there is a ligament which runs from the lateral side, from the distal malleolus or the lateral malleolus to the talus and calcaneum. These are called as the lateral collateral ligament. Lateral collateral ligament. Okay. Apart from this, the tibia and the fibula are connected by ligaments below, and they form a joint called as inferior tibiofibular joint. This joint, inferior tibiofibular joint, is an example for syndesmotic joint. It's an example for syndesmotic joint. What is mean by syndesmosis? The two bones are held by fibrous tissues, that is by ligaments alone. There is nothing there, only ligaments are there. So in such a way, one important ligament which is seen here anteriorly is called as the anterior tibiofibular ligament. Anterior tibiofibular ligament. These ligaments are very, very strong ligaments. Anterior tibiofibular ligament. Similarly, you have got posterior tibiofibular ligament. These ligaments forms a joint called a syndesmotic joint. Syndesmotic joint. The ligaments are very, very strong ligaments. They won't tear that easily. They can even fracture a bone, but they won't get torn easily. So such strong ligaments. So an ankle fracture can happen in the following ways. One is, it can happen in an isolated way. Only the medial malleolus or lateral malleolus can occur, but mostly it occurs in combination. So whenever there is fracture of lateral malleolus and medial malleolus, we call this as bimalleolar fracture. We call this as bimalleolar fracture. This bimalleolar fracture is also called as Potts fracture. The bimalleolar ankle fracture is also called as Potts fracture. Okay, when you see the ankle joint from the posterior, from the lateral aspect, so this is the tibia and this is the talus bone and this is the calcaneum bone and you get a malleolus on the posterior side also, posterior malleolus. If all the three malleolus fractures, then it's called as trimalleolar fracture. Trimalleolar fracture, which means medial, lateral and the posterior malleoli. All these three gets fractured, then that fracture is called as trimalleolar fracture, also called as Cotton's fracture. Also called as Cotton's fracture. Okay, clear? Fine. Now, whenever the ankle fracture happens, so mostly ankle fractures occurs by rotation injuries. So whenever rotation injuries happen, there can be a chance for this ligament to cause fracture here or this ligament to cause fracture here. So anterior tibiofibular ligament avulsion, anterior tibiofibular ligament avulsion, if it happens on the tibial side, can you able to understand this? See, this ligament are very strong, so they can fracture a bone from this point. So this is tibia. When a fracture occurs at this point, then it is called as Talus fracture. It is called as Talus fracture. Talus fracture. If the same kind of fracture, the same anterior tibiofibular ligament avulsion, if it occurs on the fibular side, then it is called as Lefort-Wegerstaffe fracture. Lefort-Wegerstaffe fracture. Around the ankle, all these are named fractures. That is why I'm telling all these terms. Lot of named fracture occurs. One is called as Potts fracture, which is also called as bimalleolar fracture, where only medial malleoli and lateral malleoli gets fractured. Only medial malleoli and lateral malleoli gets fractured. Okay. So that is called as Potts fracture. In trimalleolar fracture, medial, lateral and posterior malleoli gets fractured. It is also called as Cotton's fracture. It is an avulsion fracture when anterior tibiofibular ligament avulses from the tibial side. Such a fracture is called as Talus fracture. If it avulses from the fibular side, it is called as Lefort-Wegerstaffe fracture. Okay, clear? So this is about the fractures around the ankle. Again, ankle fractures are intra-articular fractures. They are around the joint, around the ankle joint. So they require fixation. Okay, they require fixation. Fixation can be done by ORIF, open reduction interval fixation with the K wires or tension band wiring or plates or with the screws alone. Anything can be done around the ankle. Okay, these are the treatment options for ankle fractures. Now coming to the calcaneal fracture. Calcaneal fractures are commonly seen in the person who jumps from a height and lands on his foot. If he jumps from a height and lands on his feet, he will have calcaneal fractures. So calcaneal fractures are, that's why called as jumper's fracture. Jumper's fracture. Mostly who jumps is those who fail in love will jump. So it is called as lover's fracture. Don't jump, guys. So this can cause fractures in those who jump from height. So it is also called as lover's fracture. So whenever calcaneal fracture happens, okay, you have to look into two important things, two important angles in calcaneal fracture. One is called as Bowler's angle. Bowler's angle. Another one is called as angle of Gizane or critical angle, which is called as angle of Gizane. It's called as critical angle. Normally, Bowler's angle is 20 to 40 degree. Gizane angle is 125 to 140 degree. Okay, we'll see what is called as Bowler's angle and what is called as Gizane's angle. Okay, you are going to draw two lines. One line along the posterior aspect of the, one line along the posterior aspect of the calcaneum over its superior surface. See, this is the posterior side and this is the anterior side. Okay, clear? And this surface is the superior surface. And this surface is the superior surface. This is the inferior surface and this is the posterior surface. Okay, clear? Now, how many lines you are drawing? You are going to draw two lines. One line along the superior surface on the posterior side, another one along the superior surface on the anterior side, and these two forms an angle here. And what is this angle called as? This is called as Bowler's angle. So this is 20 to 40 degree. If this angle decreases, it indicates calcaneal fracture. It indicates calcaneal fracture. Now, what is called as Gizane's angle? You have to draw two lines again. Just see the green lines. I draw two lines along the articular surfaces. The angle between these two is called as Gizane angle. The green line represents the Gizane angle, and this Gizane angle is 125 to 140 degree. If this Gizane angle increases, so there are two differences here. Bowler's angle decreases, indicates calcaneal fracture. Gizane angle increases, it indicates calcaneal fracture. It indicates calcaneal fracture. Are you clear in this? These two angles, please remember. Frequently asked question around the calcaneal region topic. Bowler's angle, Gizane's angle. Gizane angle is also called as critical angle. So this angle is 125 to 140 degree. If it increases, if the angle increases, then we diagnose calcaneal fracture on that. If Bowler's angle decreases, then we diagnose calcaneal fracture based on Bowler's angle. So these two angles you should remember. And calcaneal fracture, if it happens in this zone, that is in the intra-articular fractures, you should fix it. Extra-articular fractures, it can be treated conservatively. Okay. Now coming to the calcaneal fracture. Calcaneal fractures are commonly seen in the person who jumps from a height and lands on his foot. If he jumps from a height and lands on his feet, he will have calcaneal fractures. So calcaneal fractures are, that's why called as jumper's fracture. Jumper's fracture. Mostly who jumps is those who fail in love will jump. So it is called as lover's fracture. Don't jump, guys. So this can cause fractures in those who jump from height. So it is also called as lover's fracture. So whenever calcaneal fracture happens, okay, you have to look into two important things, two important angles in calcaneal fracture. One is called as Bowler's angle. Bowler's angle. Another one is called as angle of Gizane or critical angle, which is called as angle of Gizane. It's called as critical angle. Normally, Bowler's angle is 20 to 40 degree. Gizane angle is 125 to 140 degree. Okay, we'll see what is called as Bowler's angle and what is called as Gizane's angle. Okay, you are going to draw two lines. One line along the posterior aspect of the, sorry, one line along the posterior aspect of the calcaneum over its superior surface. See, this is the posterior side and this is the anterior side. Okay, clear? And this surface is the superior surface. And this surface is the superior surface. This is the inferior surface and this is the posterior surface. Okay, clear? Now, how many lines you are drawing? You are going to draw two lines. One line along the superior surface on the posterior side, another one along the superior surface on the anterior side, and these two forms an angle here. And what is this angle called as? This is called as Bowler's angle. So this is 20 to 40 degree. If this angle decreases, it indicates calcaneal fracture. It indicates calcaneal fracture. So what is called as Gizen's angle? You have to draw two lines again. Just see the green lines. I draw two lines along the articular surfaces. The angle between these two is called as Gizen angle. The green line represents the Gizen angle, and this Gizen angle is 125 to 140 degree. If this Gizen angle increases, so there are two differences here. Bowler's angle decreases, indicates calcaneal fracture. Gizen angle increases, it indicates calcaneal fracture. It indicates calcaneal fracture. Are you clear in this? These two angles, please remember. Frequently asked question around the calcaneal region topic. Bowler's angle, Gizen's angle. Gizen angle is also called as critical angle. So this angle is 125 to 140 degree. If it increases, if the angle increases, then we diagnose calcaneal fracture on that. If Bowler's angle decreases, then we diagnose calcaneal fracture based on Bowler's angle. Or these two angles you should remember. And calcaneal fracture, if it happens in this zone, that is in the intra-articular fractures, you should fix it. Extra-articular fractures, it can be treated conservatively. Okay. Okay. Foot, last 2 minutes in foot. We'll finish with that. We'll finish the lower limb, and then you can do some stretches, and then we can continue. Okay. So foot, if you see the foot has got the following bones. So one is calcaneum, which is directed laterally. Sitting over the calcaneum will be the talus, which is directed medially. Okay, it is directed medially. Talus articulates with a boat-shaped bone called as navicular. Navicular articulates with the three bones called as cuneiforms. And this calcaneum articulates with a bone called as cuboid. This articulates with a bone called as cuboid. And these tarsal bones articulate with metatarsal bones. Okay. Now I divide the foot into three parts: forefoot, midfoot, and hindfoot. Okay. So the line running through the tarso-metatarsal joint. Tarso-metatarsal joint. This line, which is running through the tarso-metatarsal joint, anything anterior to it will be forefoot. So this is forefoot. Okay. And the line which is running between the talus calcaneum and to the rest of it, this forms the midfoot. Talus and calcaneum forms the hindfoot. Talus and calcaneum forms the hindfoot. Now fractures which happens between the forefoot and midfoot. Please remember, fracture which happens between the forefoot and midfoot. That is at the tarso-metatarsal junction. This kind of fracture is called as Lisfranc fracture. Lisfranc fracture. If a fracture occurs between midfoot and hindfoot, this fracture is called as Chopard's fracture. Chopard's fracture. Okay. If I remove the bones anterior to the tarso-metatarsal junction, then it is called as a Lisfranc amputation. Lisfranc amputation. If I remove the bones anterior to the talus and calcaneum, then it is called as Chopard's amputation. Then it is called as Chopard's amputation. Clear? Chopard's amputation. See, these fractures are important, so please keep this in mind. Tarso-metatarsal fracture is called as a Lisfranc fracture. Now, there is one important bony landmark here, which is called as a Lisfranc ligament. It is called as a Lisfranc ligament. So there is a ligament which extends from the second metatarsal. Okay. Please see here. Please here. There is a ligament which extends from the second metatarsal to the medial cuneiform. To the medial cuneiform. This ligament is called as Lisfranc ligament. So three things: Lisfranc joint, Lisfranc ligament, Lisfranc amputation. So what is Lisfranc ligament? Ligament running from the second metatarsal to the medial cuneiform is called as Lisfranc ligament. Okay, Lisfranc ligament. Whenever the patient has a flexion injury to the foot, கால் முன்னாடி மடங்கி இப்படி விழுந்துட்டாங்க அப்படினா Lisfranc ligament is the one which most commonly injured. Okay, whenever there is a flexion injury of the foot, Lisfranc forefoot flexion, like you will get Lisfranc ligament injury. Okay, clear? So that is about the Lisfranc joint and the Lisfranc ligament. Now last topic is metatarsal fracture of the fifth one. So this is the fifth metatarsal. The fifth metatarsal bone can get fractured at the base, at the metaphyseal diaphyseal junction. So fracture of fifth metatarsal at metadiaphyseal junction. At metadiaphyseal junction is called as Jones fracture. It's called as Jones fracture. It's called as Jones fracture. Okay, so this is about the Jones fracture. Nothing specific about it, but there is a named fracture here. And can anyone tell me what is the stress fracture of second metatarsal called as? Stress fracture of second metatarsal called as? In the morning, first topic we saw the types of fractures. Traumatic fracture, pathological fracture. What is the other fracture? Normal bone, abnormal loading, military, policeman. What fracture is that? It's called as March fracture. March fracture. Second metatarsal fracture, which happens in repeated marching. Then that is called as March fracture. Okay.